Hi, it's Dr. Droll here from Droll Family Dentistry. There's a frequently asked question that's been coming up increasingly. Here's the deal. If you're a dentist and you open up a no judgment zone and publicize it and really work to create a welcoming space for people that need significant amount of dentistry and they know it, they're aware, and they're ready to take the next step and at least get acquainted with a dentist and get set up with some options, diagnosis, some possible treatment plans, you start to accumulate a sort of a collection of patients who are going to have a lot of work done or in the process of starting to have a lot of work done to get their dental situation under control. But not everybody is ready to get everything done all at once, and that's just real life. Dentistry is a major commitment of time and money, and honestly, sort of like hassle. Like, it's a hassle to go and get work done. Appointments, multiple appointments. Now, I'm not talking about somebody that has a couple of cavities every 2 years and comes in and gets their teeth cleaned and every once in a while needs a crown. We see a lot of patients like that too. I'm talking about patients that, for one reason or another, for life reasons, life happens, right? Maybe bad luck carries prone individuals. In other words, people who are really prone to tooth decay, people who are just naturally genetically predisposed to periodontal disease, have experienced the loss of multiple teeth, and usually have a feeling of kind of like despair or helplessness. People feel overwhelmed. Well, when you're a dentist that welcomes these kind of patients, like I've really tried to be, with the no judgment zone and really upping my game to do the reconstructions and get things under control, the frequently asked question that comes up a lot in these scenarios is like, all right, doctor, I'm not ready to get moving on this yet. What can I do in the meantime? We have to activate our prevention game. And we do. We have a whole prevention regimen for people who are kind of on standby or in a holding pattern, knowing they're going to get a bunch of work done and maybe even knowing what they're going to get done, but they know it's going to cost as much as a mid-sized SUV, and it's going to be time-consuming, and we have sequences of appointments that they need to show up for. So maybe they're waiting for one more kid to finish college, or maybe they're waiting for the busy time at work to be over for the year, or maybe they just need to wait another 12 months or 18 months to budget now that they know what's the damage and what are we up against. So we look at about basically three different things. We look for areas of active infection and inflammation, and the concern, besides like pain and unsightly teeth, things that patients might notice and ask for immediate help, things we're watching out for are things that pose a health risk or things that are going to deteriorate quickly, which is kind of the same thing. So we don't like inflammation in the body. It's dangerous. So we'll advocate for getting teeth clean sooner, especially when there's an inflammatory thing like periodontal disease, gum disease requiring a more involved cleaning. We'll encourage patients to get that done sooner. We will schedule for kind of like putting out fires too. We're going to advocate to get moving on procedures that involve infected teeth, because infection in the body is infection in the body. It increases risk of other health problems. Their scientific community is starting to understand that prediabetes, cardiac risk, all these things can relate to inflammation and infection in the mouth, right? So we call that disease control, let's say. We call that putting out fires. So we'll advocate for treatment of the worst troublemaker teeth and maybe gum situations and some upkeep. We will introduce prevention in the form of fluoride rinses, anti-cavity rinses, rinses that help control the bacteria that are causing gum disease and inflammation. And we can do quite nice things relatively inexpensively to keep somebody in a holding pattern for a long time using things like mouth rinses and so on. Then I think the third thing that just needed to be mentioned, and I try and mention it to everybody, is what I like to call, we wait with you. We're ready when you are. We're ready to help you. We can set up appointments, but we're not going to push you to make appointments to get some major dentistry done until you're ready. We will help you understand cost and what kind of things you're going to have to do, how many appointments, what are the unknowns that might surprise us during treatment that we just need to anticipate and be ready for, and try and give you a good, clear picture of the final result. And then we just wait. So I have a lot of patients who are in a holding pattern, who are waiting, and one day they're going to call and they're going to be ready, and that's the most wonderful news when it comes. I don't want to work on someone who's not really ready. That's not going to go well. I want to hear from people when they're ready and they can enter into the treatment with the right kind of enthusiasm that we need, because it's kind of tough. It's tough to go through changes, and it's tough to come into appointments and get work done. We try and make it as easy as we can, but we just recognize it takes time. When I need something for myself that I know I've been needing for a while, a major purchase or something, I don't hurry either. I'll buy some little thing that I want pretty quickly. If I see something shiny at the checkout line at the store, sure, throw it in the cart, right? But I don't want anybody impulsively opting into extensive dentistry. So hopefully this helps some people understand. You sort of know who you are. If you're behind on your dentistry, we're ready to get you up to date with information about your situation and options, and then we'll just wait with you. And we'll help you stay in a holding pattern safely until you're really ready to get things going. Have a good one.